You have 5 minutes for questions, please.
Thank you very much, Mr. Chairman. Dr. Gottlieb, you all are not the only ones who are looking at some of these things. Am I correct in that? And the reason I raised that issue is you said several times y'all don't look at when the international mail facilities and so forth, and I'm just trying to figure it out because we recently had one of those drop sting operations in my district, but it was for a small amount of fentanyl to what would appear to be personal use for somebody who was just ordering it over the internet and coming in. They said in the newspaper article that was Customs. Would that have been you all as well?
Customs has primary responsibility in the IMFs for things identified as controlled substances. We will oftentimes work with them. We have criminal investigators that will sometimes work with them. We provide certain expertise.
But you focus on the big shipments, is that correct?
We focus on, so when Customs will they'll x-ray all the packages, and they'll also do some detection, including with dogs, to try to pull out the ones that they believe have controlled substances. They will pull a certain number of packages that they identify with pills that they believe are for secondary distribution based on either volume or where it's coming from. They'll pull them for physical inspection for FDA in those facilities. They'll only pull the number of packages on a given day that they think we can physically inspect inside each facility.
All right, let's talk about that. The Blackburn bill is very interesting, and we heard comments from Mr. Lance, and you showed us all those slides. So what I'm asking you is, should we put into the Blackburn bill authority for you all to say a shipment has to have this specific labeling and give you the authority, if that labeling does not exist, for all those pictures we saw of the boxes and boxes of drugs that were unlabeled, you just automatically get to destroy those. Wouldn't that be helpful if we added that in?
Well,
yes or no? Because I'm running out of time.
It would make us more efficient, and the Blackburn bill does provide for that because it allows us to make a determination that it's a drug based on chemical composition, if I'm remembering the bill correctly, and then we go to the secondary question of whether or not it's labeled appropriately, and most of these products wouldn't be; they'd be misbranded.
And what I'm indicating to you is, if it's not labeled at all, before you even get to trying to test it, if it comes in and it's not labeled,
targeting, yeah.
Destroy it.
You're speaking about the information, the manifest data and the information we have about the package or the labeling on it.
You showed us pictures of all of these unlabeled items coming in. You didn't know what they were. The purple pills, you weren't sure what they were. We know what they're supposed to be, but and so forth. Wouldn't you all like the authority just to be able to say, if it's not labeled in accordance with what you've set forth with your standards, it's coming from some foreign country, let's just destroy it? And wouldn't that free up a lot of time for going after the folks who might be shipping something in that is labeled, but labeled improperly?
So not established that it's a drug at all.
Yeah,
destroy it.
It's not labeled, destroy it.
I haven't contemplated it. You know, there'd be dietary supplements.
Think about it and get back to me.
As well. Thank you.
I appreciate that. All right,
Congressman.
Dr. Shikat. We've got a discussion draft being considered to help CDC and in turn the states build upon and improve state PDMPs, the prescription drug monitoring programs, to achieve maximum effectiveness. How would that discussion draft help the CDC?
Yeah, we think that having improving the state-specific PDMPs and access to a national platform that would help them share data across states and have everybody benefit from the upgrades that individual states have done would be helpful. We need to make sure that we reflect the state-specific laws and policies and that they need access to their data to be able to use it and improve it. And we don't really want the lowest common denominator state to be what a new interoperable system would be, but greater attention to the prescription drug monitoring programs and the flexibility to improve them rapidly is important.
All right. Now, I know this is going to get controversial, but you said something earlier that triggered, my brain to work it on something.
Okay.
You said that some of these programs will alert the healthcare provider if they're over-prescribing an opioid. Is that correct?
About high dose, if you have many different types of opioids, you can't in your head calculate what's the morphine milligram equivalent. In our guideline, we alert people that over a certain level, special attention is needed because the border between safely taking those medicines and unintentionally overdosing is small. So we want clinicians to recognize when the cumulative opioid level is very high so that they can look into it and assess whether it's needed or not.
All right. Yesterday on O&I, we were talking with DEA and all the problems we're having there with pharmacies and some doctors. Would it be helpful or would it create problems if we shared that information when a doctor consistently or a healthcare provider consistently is giving too high doses out, would it be helpful to share that information with the DEA so that we can maybe identify quicker where we might have a problem? Try to educate first if it's not criminal, but then look at it if it is.
You know, in most states, the medical boards would be looking at this high-level prescribing. I think we do think sharing information across systems is really helpful to alert for whatever the issue is. But in terms of the what the prescription drug monitoring programs are doing is they're looking at prescribing to the patient, not, you know, the pharmacy level data. And Dr. Jones might have something to add there.
Dr. Jones, you want to add to that?
I would just say, I mean, the states are because PDMPs sort of fall under the rubric of practice of medicine, practice of the health professions, they have different variations in their state statutes, but many of them do have proactive reporting. So it's looking at, you know, outlier prescribers and either sending that in some cases to the medical board, in some cases to law enforcement.
Okay, because one of the issues yesterday was getting the information to show that a healthcare provider, whether it be a pharmacist or a doctor, was not following standard medical procedures in order to get a show cause order. Now, I was more concerned with the ISOs because I think they're not using those effectively and should be more aggressive on that. But in the show cause, this is information that could be very helpful, and I would hope we could figure it out. I know it's a little dicey, and I appreciate your time and yield back.
Gentleman yields back, Chair. Thanks, the gentleman.